Assalamu alaikum doctors, welcome to my YouTube channel MBBS and BDS lectures. Today is the third video of revision course of oral and maxillofacial surgery, which is very important for NLE, MDS and BDE as well as for BDS students. In this video we will discuss about sutures and its types, surgical needles and suturing principles and different types of sutures. First question is in the blue box, why do you need to suture? Why do you need to suture? There are three reasons. Number one, reapproximating the wound edges together until healing occurs. Second, protecting underlying tissue from infection or other irritating factor because underlying tissue is exposed. Third, preventing post-operative hemorrhage. These are the indications of suture. Now, ideal suture material should be non-toxic, non-allergic. Second, no wicking effect. What is wicking effect? Does not allow fluids to pass through them. And this wicking effect is present in polyfilament suture material but not in monofilament. Third is suture material should be strong, and fourth, it should be flexible to be easily tied. Now the suture diameter noted by number of zeros. The more zeros, the smaller the diameter. In surgery we use mostly 3 or 3 into 0, from 3 to 0 sutures. Now come to the suture types. We basically classify the suture types on the basis of three. Number one is resolvable and non-resolvable. Second is the polyfilament and monofilament, and third is the natural and synthetic. Now in natural like silk and sheep intestine mean plain gut. In synthetic there is a most commonly used is a vicryl. Now come to the resolvable and non-resolvable. In the resolvable is used for internal tissues of the body, children, mentally handicapped, or patient who cannot return to the clinic to have the suture removed, and that patient we give resorbable suture. In other we give non-resorbable. Now the resorbable suture types are the first is the plain gut, which is the natural suture, and we take from sheep intestine plain gut, and it's dissolved after 3 to 5 days. Second is the chromic gut. Again it is a chromic gut. Again it is a natural suture, and it's dissolved after 7 to 10 days. Next is the polyglycolic acid, which is a dexone, and next is the polygalactin, which is vicryl and dissolved after 30 days. And vicryl is the most commonly used suture in dentistry, meaning oral and maxillofacial surgery in oral region. Next is the non-resorbable. In non-resorbable there is a silk, which is the most common. Why? It is cheap, easy to use, and good to hold a knot. Next is the nylon, and next is the stainless steel. Next is the third classification is the polyfilament and monofilament. And polyfilament is made up of polyfilament, and monofilament is from one filament. Now, what are the advantages of polyfilament? Easier to tie, but easier to tie. The cut ends are soft and non-irritating to the tissue. But there is a wicking effect, mean it polyfilament have wicking effect, mean it fast fluids and microorganism, and it will cause infection. Next is the monofilament. Here the advantage is no wicking, mean it does not pass fluids and microorganism. Next, it is difficult to tie, plus tend to come united. The cut end are stiffer and more irritating to the tissue. These are the types of suture: natural and synthetic. Next is the resorbable and non-resorbable, and next is the polyfilament and monofilament. Now come to the needle. There are two types of needle: round needle and triangular cross section. Round needle and triangular cross section. And round needle, also known as atraumatic, and are mainly used for suturing thin mucosa, but pressure is required when passing through the tissues. Remember, round needle is used for thin mucosa. Second is the triangular cross section. It is a sharp cutting edge per. It is a traumatic needle. Sharp cutting edges for suturing thicker tissue. Per thin tissue, round needle. Per thicker, there is a triangular. And round is known as atraumatic and triangular is traumatic. If used for thin mucosa, if triangular is used for thin mucosa, tearing may occur. And in triangular, there will be conventional cutting and reverse cutting. In conventional cutting, cutting edge apex of the triangle on the inside of the semicircle. But in reverse cutting, cutting edge outside of the semicircle. Look at the conventional cutting and reverse cutting. Now come to the suturing principles. In suturing principles, the first is the needle should pass from the mobile tissue toward the fixed tissue and be at least 5 mm from the edges. Second principle is the avoid over tightening the suture. In the result, there will be a risk of tissue necrosis. Third, the two ends of the suture are tied in a knot and are cut 5 mm above the knot. The fourth is that the knot should be placed to the side but not over the incision, since it will act as a stagnant area for debris deposition. Now come to the suture types. There are 4 types: simple interrupted suture, and second is the continuous suture, and third is the figure of 8, and fourth is the horizontal mattress suture. First is a simple interrupted suture. In simple interrupted suture, basically it is used for a small wound area, and in a simple interrupted we give a separate suture. We give a separate suture on that area. But the advantages is, if placed in a row, loosening up one stitch will not influence the rest because it is separate. This is simple interrupted. Second is the continuous, usually used for suturing long incision. Per long incision, per short incision we use simple interrupted. Per long incision we use continuous. Incision for reshaping of the alveolar ridge. If we do a reshaping of the alveolar ridge like alveoloplasty, then we go for suturing. Per long incision we give for continuous suture. Advantage is the quick with few knot to collect debris. But disadvantages is if one stitch get cut or lost, the entire suture line become loose. Next come to the figure of 8. To maintain the blood clot or hemostatic material in the alveolar socket after extraction, we give figure of 8. And next is the if we do a traumatic extraction, then we go for, if there is a bleeding tendency of patient, we go for figure of 8 suture. Next is the horizontal mattress suture. When we need tight reapproximation, then we go for horizontal mattress suture. This is all about suture and its types, its indications, needles, suturing principles, and types of sutures. Now today our topic is complete. If you like my video, press the like button and share this video with your friends. If you are new to my channel, subscribe my channel by pressing the red subscribe button, and also press the bell icon in order to receive my each new video notification. For watching my videos, I am very thankful to you. Thank you very much.